Imagine waking up one morning and realizing your vision is blurry, distorted, or worse, gone. For millions of people with diabetes, this nightmare is a reality. The culprit? A silent, sneaky condition called diabetic retinopathy. Most people don't notice it until it's too late. But today, you're going to discover the 7 warning signs that can save your vision. If you have diabetes or care about someone who does, this video is a must-watch. Segment 1. What is diabetic retinopathy? Diabetic retinopathy is a diabetes-related complication that affects the eyes. It happens when high blood sugar damages the tiny blood vessels in the retina, the part of your eye responsible for vision. Over time, these blood vessels can swell, leak, or even close off completely, cutting off vision. In advanced stages, abnormal new vessels can grow, leading to severe vision problems and even blindness. The scary part? You may not notice any symptoms in the early stages. That's why catching the warning signs early is so important. Segment 2, the 7 warning signs of diabetic retinopathy. Let's break down the signs. Some are subtle, others more obvious, but all of them deserve your attention. Sign number 1, blurry vision. Blurry vision might seem like a minor inconvenience. Maybe you think you're just tired, dehydrated, or need new glasses. But for people with diabetes, it can be much more serious. Here's why it happens. When your blood sugar levels are too high for an extended period, they can cause fluid to leak into the lens of your eye. This lens helps you focus, kind of like the lens of a camera. When it swells or changes shape due to fluid buildup, it becomes harder to see clearly. Everything looks out of focus. And here's the tricky part. This blurriness might come and go. You might have clear vision in the morning and notice it getting worse later in the day. Or it might improve for a while, only to return a few days later. This inconsistency makes it easy to ignore. But it's actually a warning signal from your body. Over time, if the high blood sugar isn't controlled, the damage can move deeper, from the lens to the retina, where diabetic retinopathy truly begins. The retina is the light-sensitive layer at the back of your eye. If it's damaged, your vision can worsen permanently. Blurry vision might also be a sign of macular edema, swelling in the central part of the retina, which affects your ability to read, drive, recognize faces, or see fine details. Here's a simple way to know if blurry vision might be related to your blood sugar. Does your vision get better after you manage your blood sugar? If so, that's a strong clue. But don't wait for it to get worse. If you're experiencing repeated or persistent blurry vision and you have diabetes, get your eyes checked right away. A dilated eye exam can reveal whether you're showing early signs of diabetic retinopathy. Sign number 2, floaters or dark spots. Have you ever looked at a white wall, the sky, or a bright computer screen and noticed small shapes drifting across your vision? They might look like tiny dots, threads, cobwebs, or even little clouds. These are called floaters. Floaters are actually tiny clumps of gel or cells inside the vitreous, the clear, jelly-like substance that fills the center of your eye. Normally, floaters are harmless and common, especially as people get older. But in people with diabetes, floaters can be a serious warning sign. Here's what happens. When your blood sugar is too high for a long time, it can damage the small blood vessels in your retina, the part of your eye that senses light. These damaged vessels can leak blood or other fluids into the vitreous. That's when floaters appear more often or suddenly seem worse. What makes this dangerous is that the bleeding can block your vision. You might see a sudden shower of black spots, a large dark shadow that moves across your sight or areas where vision is missing, like a curtain being pulled over part of your eye. This could mean you're experiencing vitreous hemorrhage, bleeding inside your eye. And it gets more serious. Floaters caused by bleeding might be an early sign of proliferative diabetic retinopathy, an advanced stage of the disease. At this stage, new abnormal blood vessels grow in the eye, but they are very weak and break easily, causing more bleeding and possibly even retinal detachment, which can lead to blindness. Sign number 3, poor night vision. Do you ever find it hard to see clearly when the lights are low? Maybe you're driving at night and the road seems dimmer than usual. Or you walk into a dark room and your eyes take a long time to adjust. This could be a sign of poor night vision, and for people with diabetes, it's an important early warning of diabetic retinopathy. Why night vision gets worse in diabetes. Your retina, the light-sensitive layer at the back of your eye, helps you see in both bright and dark conditions. It's full of special cells that detect light and send signals to your brain to create an image. But when your blood sugar stays high over time, it damages the small blood vessels that keep the retina healthy. These vessels may start to swell or leak, become blocked, or stop supplying enough oxygen to the retina. As a result, the retina doesn't work as well, especially in low light. That's because night vision depends on cells called rods, which are highly sensitive to dim light. If those cells don't get enough oxygen and nutrients, they become weaker or even die. This means your eyes struggle to adjust when you go from light to dark, and you may notice difficulty seeing while driving at night, struggling to read in low lighting, longer time for your eyes to adjust in dark rooms, halos or glare around lights at night.
Important to know. Poor night vision may start gradually, so slowly that you may think it's just age or fatigue. But if you have diabetes, don't ignore it. It could mean your retina is being damaged silently. In fact, poor night vision is one of the earliest signs that something is wrong with your eyes. The longer you wait, the more damage can occur, sometimes without pain or obvious symptoms. What you should do: get a dilated eye exam at least once a year. Tell your doctor if you're noticing more difficulty seeing in the dark. Keep your blood sugar, blood pressure, and cholesterol in good control. Eat foods rich in vitamin A and antioxidants, which support retina health. Sign number 4. Sudden vision changes. Have you ever experienced a sudden change in your vision, like things becoming blurry all at once, or part of your vision going dark for no reason? For someone with diabetes, this isn't just a random event. It could be a serious warning sign of diabetic retinopathy or other eye complications. What do we mean by sudden vision changes? This could include your vision going blurry without warning, seeing flashes of light or sudden floaters, having part of your vision blocked or missing, like a shadow or curtain, sudden distortion of shapes or straight lines, rapid loss of central vision, hard to read, recognize faces, or see fine detail. These changes may happen in one eye or both eyes, and they can come on very quickly, sometimes in just minutes or hours. Why it happens in diabetes? When blood sugar levels stay high for too long, it damages the tiny blood vessels in your eyes. These vessels can leak blood or fluid, break and cause bleeding inside the eye, or the retina can swell due to fluid buildup. In more severe cases, the retina can detach, pull away from the back of the eye. All of these problems affect how light reaches the retina and how clearly you see.
The result is sudden, dramatic changes in your vision.
Sometimes, these changes are temporary, especially if they're due to fluctuating blood sugar. But other times, they signal something more dangerous, like retinal hemorrhage, macular edema, or retinal detachment. Emergency alert: if you ever experience sudden vision loss, flashes of light, or a dark curtain over your vision, get emergency medical attention immediately. These are signs that the retina may be bleeding or detaching, and fast treatment can save your sight. What you should do: don't wait or assume it will go away on its own. Call your eye doctor or go to an emergency clinic right away. Track when the symptoms started and what you were doing. Keep your blood sugar levels stable to avoid sudden vision shifts. Get regular retinal exams to catch issues before they become urgent. Sign number 5. Vision loss in one or both eyes. Imagine waking up one morning and noticing that part of your vision is missing. Or you're reading a book and suddenly can't see the words on one side of the page. This isn't something to ignore, especially if you have diabetes. Losing vision in one or both eyes, even partially, is one of the most serious signs of diabetic eye disease. What does vision loss mean? It doesn't always mean going completely blind. It can start as blurry or faded vision in one part of your eye, a shadow or dark spot that doesn't go away, loss of central vision, making it hard to read or recognize faces, loss of peripheral, side vision, things disappear out of the corner of your eye, a feeling like a black curtain has come over part of your vision. It may happen gradually, but in some cases, vision can be lost suddenly, in hours or even minutes. Why does this happen in diabetes? When blood sugar stays high, it damages the blood vessels in your retina, the part of the eye that captures light and sends images to your brain. In advanced stages of diabetic retinopathy, several serious problems can occur: retinal bleeding, vitreous hemorrhage, blood leaks into the center of the eye, blocking your vision; macular edema, swelling in the central retina, macula, which controls sharp, straight-ahead vision; retinal detachment, the retina pulls away from the back of the eye. This is an emergency and can cause permanent blindness; neovascular glaucoma, abnormal blood vessels grow and block fluid drainage in the eye, causing high eye pressure and vision damage. What you must do: if you notice any sudden or severe vision loss in one or both eyes, this is an eye emergency. Get to an eye doctor or emergency room immediately. Every hour matters when it comes to saving your vision. Even if the vision improves slightly, don't wait. The underlying damage could still be happening inside your eye. Tips to protect your vision: control your blood sugar, blood pressure, and cholesterol. Get a dilated eye exam every year, or more often if your doctor recommends. Report any vision changes right away. Even if they seem small, take action early. Vision loss is often preventable when caught in time. Sign number 6. Difficulty seeing colors. Have you noticed that colors don't seem as bright as they used to? Maybe your favorite red shirt looks dull, or your blue curtains seem more like gray. If you're living with diabetes, this fading of color could be a subtle but important warning sign of diabetic eye damage. What's really happening? Your ability to see and distinguish colors, especially rich, vibrant tones, comes from special cells in your retina called cones. These cells detect color and help you see the difference between red, green, blue, and all the shades in between. But here's the problem. When blood sugar levels are high over time, the small blood vessels that supply your retina can become damaged. These vessels may leak fluid, or blood become blocked or stop delivering enough oxygen. Without proper oxygen and nutrients, the cone cells begin to weaken, and that affects your color vision. What you might notice: colors seem dull or faded, like you're looking through a foggy window. Difficulty telling the difference between similar colors, like blue versus purple or red versus brown. Trouble seeing colors clearly in low light. Overall vision might also seem washed out or grayish. This can be frustrating, not just for everyday things like choosing clothes or cooking, but also for activities like driving, reading labels, or recognizing signs. Why it matters: difficulty seeing colors may seem like a small issue at first, but it often points to a larger problem in the retina, such as macular edema, swelling in the center of the retina, where color vision is strongest. Diabetic retinopathy progression, which affects both sharpness and color clarity. Early signs of optic nerve stress or damage. Ignoring it could lead to more serious vision problems later, including permanent vision loss. What to do? Get a comprehensive eye exam, not just a basic vision test, but one that checks for retinal damage and color vision problems. Control your blood sugar levels tightly. Even small improvements can reduce stress on your retina. Eat foods rich in antioxidants and carotenoids, like spinach, kale, and carrots. They support healthy vision. If you're struggling with color tasks, talk to your doctor or optometrist. Color-enhancing glasses or adjustments at home can help in the short term. Sign number 7. Eye pain or pressure. Most people think vision problems from diabetes are painless, and often they are. But if you're feeling pain, pressure, or discomfort in your eyes, that's a red flag that something more serious might be happening. For people with diabetes, this can be a sign of advanced diabetic eye disease or even glaucoma, a dangerous condition that can lead to permanent vision loss. What kind of pain are we talking about? You might notice a dull aching feeling behind your eyes, sharp pain that comes and goes, a sensation of pressure or tightness, especially in or around one eye, headaches that seem centered behind the eyes, pain when moving your eyes or blinking, increased sensitivity to light, photophobia, Even mild pain or pressure can signal that something is wrong with your eye's internal structures.
Why does this happen in diabetes?
Chronic high blood sugar can affect many parts of your eye, not just the retina.
Over time, it may lead to 1. Neovascular glaucoma. In this condition, diabetes causes abnormal blood vessels to grow on the iris, the colored part of your eye. These vessels block the normal drainage of fluid from the eye, causing pressure to build up inside. This leads to glaucoma, and that pressure can cause serious pain and damage to the optic nerve. Iritis or uveitis. This is inflammation inside the eye.
It may feel like a deep ache and can come with redness, blurred vision, or sensitivity to light.
While not always directly caused by diabetes, diabetic patients may be more prone to it due to weakened immune function.
Sudden bleeding or retinal damage. If blood vessels burst inside the eye, causing a vitreous hemorrhage or retinal detachment, you might experience a sharp or throbbing pain along with sudden vision loss or floaters. Don't ignore it. Many people think eye pain is just a result of eye strain, screen use, or tiredness. But for someone with diabetes, any unusual pain or pressure in the eye is serious.
Do not wait it out. If untreated, increased pressure in the eye can damage your optic nerve permanently, leading to blindness. What you should do: see an eye doctor right away, especially if the pain is sudden, severe, or comes with vision changes. Request a pressure check and dilated eye exam to look for signs of glaucoma or retinal problems. Control your blood sugar and blood pressure. They directly affect the health of your eyes. Avoid self-medicating with over-the-counter drops unless advised by your doctor. Segment 3, Real-Life Story. Meet Sarah, a 52-year-old teacher who had no idea she was at risk. She ignored mild blurriness and floaters for months. One morning, she woke up and couldn't see out of her right eye. A visit to the eye doctor revealed advanced diabetic retinopathy. After multiple treatments, she regained some vision, but not all. Her story reminds us, early detection is everything. Segment 4, What to do if you notice these signs. If you notice any of these symptoms, don't panic, but take action. See an eye doctor, ophthalmologist, immediately. Get a dilated eye exam at least once a year. Track your blood sugar, A1C, and blood pressure consistently. Don't skip diabetes medications or insulin. Avoid smoking, it worsens blood vessel damage. Eat a retina-friendly diet, leafy greens, omega-3s, and antioxidants. Segment 5, Can diabetic retinopathy be prevented or reversed? The earlier it's caught, the better your chances of slowing or stopping the progression. In some cases, vision can even be improved. Treatments include laser therapy injections, anti-VEGF, vitrectomy surgery, and of course, tight blood sugar control. Final segment. Call to action. Your eyesight is precious. Don't wait for the signs to worsen. Share this video with someone who has diabetes. You might just save their vision. Have you or a loved one experienced any of these symptoms? Let us know in the comments. Don't forget to like this video, subscribe to Diabetes Health World, and turn on the bell so you never miss important health updates. Stay healthy, stay informed, and see you in the next video.